More people in the U.S. die from lung cancer than any other type of cancer. This is true for both men and women. And as we raise awareness for early detection, Ascension St. Vincent's pulmonologist, Dr. Akram Shibani, joins us to tell you about how you can potentially save your life or the life of a loved one. Good morning to you, Doc.
Good morning. Thank you for having me.
Thank you. So certainly when you think of lung cancer, you think of smoking, but that is not the only factor that goes into this diagnosis.
Correct. About 80% of cases of lung cancer are related to smoking. There are other risk factors, including radiation, family history, genetics, that are involved in the other 20% of cases that are not related to smoking. But the vast majority is related to smoking.
All right, so this is all about lung cancer awareness. Early intervention really makes your chances so much better. So what are some of the warning signs for a patient, for someone to go to a doctor?
So we have guidelines nowadays for early detection and screening. The idea is to detect the lung cancer before we develop symptoms. When we think about symptoms, we are thinking that it's not too late, but if we detect the disease earlier in the course, we may have better options and better outcomes. So the guidelines for detection of lung cancer screening is if you are between the ages of 50 and 80 years and you smoked for more than 20 years, one pack per day for more than 20 years, and you are either actively smoking or you quit smoking within the last 15 years, you should talk to your primary care physician about lung cancer screening. And we do lung cancer screening nowadays with what we call low-dose CT scans, where we use low doses of radiation in order to perform those CT scans on a yearly basis.
So certainly that CT scan is something that you want to do annually because things can change. So that's the
Correct.
time period, you book it. And I mean, these are easy. They're usually covered by insurance. It's not a big hassle.
Correct. It is not a big hassle. It's a quick test. And as I said, very low doses of radiation. And we should do them on an annual basis. And when we detect those nodules, it depends. We call them nodules because they're usually small in size. If you think of a 1 centimeter nodule, that's the size of a pea. So when we detect those nodules based on the size of the nodule, we formulate a plan of either follow-up or biopsy. So if it's smaller than 8 millimeters, we usually follow it up. And if it's bigger than 8 millimeters, now we can perform biopsies using technology, what we call navigational bronchoscopy or robotic bronchoscopy, that is state of the art that we have here available to us. And we have excellent results in early detection. And that would provide the patient with excellent results with almost curative therapeutic options.
All right, Dr. Shibani with Ascension St. Vincent's, thank you so much. We hope this segment saves lives.
Thank you. Thank you for having me.